Good morning, everyone. Thank you for joining us today for Building a Resilient Workplace, Strategies for Supporting Your Team's Mental Health. I am Ernesto Burton. I'm the publisher of New Hampshire Business Review, and it's my pleasure to welcome you here today. Our webinar today is sponsored by United Healthcare and Anthem. And we have two fantastic speakers who are going to talk to us about how we can ensure that our workplaces are supporting employee mental health and the different strategies for that. It's worth noting that 1 in 5 adults will deal with mental health issues each year, according to the National Alliance on Mental Illness. And in the U.S. economy, serious mental illness costs more than $193 billion annually in lost earnings. So this is certainly a human problem and a humane problem to solve, and it's also a business problem. To help us figure this out, we have today Caitlin McCormick, Vice President, Sales and Account Management from United Healthcare, and Maria Prue, President of Anthem Blue Cross and Blue Shield. First, we are going to hear from Maria. Maria, welcome.
Great. Good morning. Good morning, everyone. Sorry, little technical difficulty. Can you see and hear me?
Yes, I can. Welcome.
All right. Well, thank you for having me. And good morning, everyone. I'm really happy to be here, especially given the topic around mental health. I don't know that I need to tell everyone that's joined us today that we are facing a mental health crisis in this country. There's a lot of data points, as you can see on this slide, that support why we would say we are facing such a crisis. But I think there's two real important points that I want to make that sort of hopefully will drive the point home for all of you. First is that when we think about the feedback that we see from our employers, mental health was identified as the #1 area of concern when we look at the 2024 survey from the National Business Group on Health, where employers have a voice to really answer what are they seeing in their workplace and what are their biggest concerns. And so mental health this year was the #1 concern. And in fact, 77% of the employers that responded indicated that that they saw a rising crisis in their employee population. That was up from just 44% of employers only a year ago that were really focused on mental health as a problem within their employee population. And then, I think, why are our employers identifying this as such a big issue? I think #1, they're seeing the impact of these mental health issues within their employee population. They're seeing the absenteeism increase, the loss of productivity in their employee workforce for their employees who are struggling with the mental health issues and not getting or accessing the care that they maybe need. And then second, they're seeing it through their rising healthcare costs, right? If we think about costs annually, year over year, and the increase to healthcare premiums, the costs specifically associated with the rising mental health conditions that we're seeing are significantly increasing costs from an employer perspective. If you think about in just 1 year, looking at data, 77%, we've seen a 77% increase in physical health spend for employees that have both mental health and physical health conditions. And I'm going to talk a little bit more as we progress through the slides about what that means and how that shows up in the workforce. And importantly, what are we doing about it to help employers address some of these concerns? So I think if we can go to the next slide, I think, this to me is probably, one of the most important slide that I will talk with you all about today. And the theme is really around how do we change the narrative when we're talking about mental health and move it from a conversation where mental health has historically been seen as specialty care rather than seeing mental health as primary care. It's sort of an odd construct if you think back about how we bucket care. We're all one person. We all have a set of needs, whether those needs are physical or mental, it's still the one person. And I think, as a result, folks have always thought of mental health sort of off to the side as a specialty care need. And, what we really are driving is a conversation where we're trying to reframe it and say, mental health is primary care and it needs to be treated as primary care. And again, it's what we're hearing from our employers on the growing need, but it's also what we're seeing in the rising costs. You can see right on the slide, 70% of the primary care visits that we're seeing through our claims data are coming in with an associated mental health condition on the primary care claim. So that's staggering. If you think back just a couple years and you look at primary care visits, how many of you were having conversations in your annual visit, where you were talking about things like, your mental health, versus today where we're seeing that uptick when we look at our claims data. And so what do we need to do about it? And I always think about this in two ways. When you get past, thinking about this as primary care, well, how do we actually support members in this journey? And I think about it as, in two ways. First is really increasing access to the mental health care that, employees need. But then how do we reduce the barriers to that access? Because I think even when we drive broader access, there are still barriers that employees may feel or see that prevent them from actually accessing or scheduling a visit or taking advantage of a program. And so as we've thought about it here at Anthem, our work around the access has really been about not just increasing the amount of providers that we're making available in the market, but also increasing, the ways in which people can access mental health support. I think what the pandemic taught us, and what we still see today, is that the use of virtual care is very powerful, especially when we think about mental health, because many people only experienced receiving mental health care during the pandemic for the first time. And when they accessed that care, they did it digitally. So it's not a care type where they were doing a lot of in-person and sort of had to transition into the virtual world. We saw many employees and many of our members accessing this care for the first time through a virtual modality. And so when you think about how you can expand access, yes, you can grow your footprint of your in-person providers, boots on the ground in the state of New Hampshire. But we all know there's only so many boots on the ground in our state. And so it's really being able to leverage, those providers that may be out of state, but that we can make accessible to our members in state through the virtual care modality. And so we've done a lot of work in that space over the last 18 months to really grow the footprint of our network and make that care, not only grow that access, but as I said, reduce a barrier to that access by offering that access, whether it's through in-person visits or virtual care visits or even chat visits, which we've now made available to our members. And I think what it allows us to do is really meet members where they're at. So how are they comfortable receiving care? Do they want to be in person, or would they rather do this virtually? But also, if you just think about your employees and the schedule of the day, if the in-person providers are not available after hours or early in the morning, is the care truly accessible for your employees who might work 8 to 5 every day? So having those options for virtual care after hours or in the middle of the day, if they have a lunch break, it really does allow us to open up that access to our members. I think importantly, you can't talk about barriers to access without talking about cost. And I think, again, because traditionally mental health has been seen as specialty care, the cost to see mental health providers has at times been cost prohibitive for our members, because each time they want to see their therapist, they might be paying a higher out-of-pocket cost. And so we took a look at this, from an Anthem perspective across our membership over the last couple of years. And we said, what can we do to not only just talk about the fact that we want our members to get the mental health care that they need, but reduce that cost barrier. And I think importantly, we've been very excited. We've been out in the market since January 1st, and really even before, talking about the fact that as of January 1st, for all of our benefit plans, we've actually reduced the copays for mental health care for our members, where we've actually brought that copay, which has traditionally been a specialist copay, down to the PCP or primary care level copay. Because again, we fundamentally believe if we can reduce that cost barrier, that it will allow more of our members and your employees, it will allow them to actually take advantage of all this additional access that we've been building within our system. So if we want to move to the next slide, and talk about, how as an employer, when you think about, something that I said before, which is how do you meet your employees where they're at? And it's really the continuum of what you offer. And, that's where, you should be really leaning in heavily, on the carrier that you work with, to really understand all of the options that your carrier is making available to you and your employees, so that you can then translate that with the help of your carrier and ensure that your employees understand all those options. So we've talked about, sort of the traditional mental health support, therapy, whether it's virtual, whether it's in person. And as I said, we've done a lot of work in this space over the last 18 months to sort of grow that network, sort of on the more on the left-hand side of the circle, as you see. And we've brought in, new providers like Aspire 365, which deals with mental health conditions and substance use disorder conditions. In Stride Health, who we're so excited to talk a lot about, who we brought into the market on January 1st, that only works with children ages 7 to 22. And I know that Caitlin's going to talk a lot about mental health in children and teens and how important making those access options are. But then you also have other options that are available to your employees that you may be paying for today, that you maybe even don't realize the value that you can drive for your employees through these programs. And those are things like, what we talk about, we say EAP, or your employee assistance program, as well as additional emotional well-being resources that are generally made available to you and your employees just through your benefit plan design through your carrier. And so I want to, if we can move to the next slide, just talk a minute specifically about your EAP and your emotional well-being resources. So these are programs that, we offer to our employers and their employees through our benefit plans. And I'm sure, most carriers do. But again, these are options that I would say are meeting your employees where they're at. So, for employers who maybe aren't ready for, therapy, and they're not, whether virtual or in person, it's not a path they're yet ready to go down, but they may be struggling and they may need support. And so, helping your employees understand these programs that are generally very easy to access through your carrier's app. I know for Anthem members, we make all these programs available right through our Sydney application. And it allows your employees to take advantage of these resources in their own time, when they're comfortable, and then how they want to leverage them. Whether it's going through things like, I want to take a self-assessment, I want to see where I'm at. And then I take the self-assessment and I say, well, I might not be ready for therapy, but I'd love to maybe have a coach that I can work with. And these resources are generally available to your employees. When we think about EAP, I often think this is a very underutilized benefit, and employers and their employees don't always understand the value that you can drive through your EAP benefit with short-term care programs that offer work-life balance, even things like financial care support. A lot of the mental stressors that folks face in life tie right back to their financial situation. And through these emotional well-being resources and EAP programs, there are financial mental health resources available that can help coach your employees to set up a financial plan that allows them to truly understand what income they're bringing up in every month and what bills they're paying out. So it's very simple resources like that when you think about financial well-being, that if you can help your employees and guide them to these resources, it is going to help support support them in their mental health journey. And then finally, if we can turn to the last slide to bring it all together, I've talked a lot about the resources available, and I've talked about, how, it's really important as employers that we make sure that we make these options available to our employees. But then it really comes down to, well, how do I communicate all this? As an employer, yeah, I'm doing the right thing. I'm offering the benefit plan, and in the benefit plan, we offer all of these programs and resources. But, my struggle as an employer is I don't really see my employees taking advantage of it. And so, this is where I think that, the awareness and how you communicate these things is as important as the solutions themselves that you're putting forth for your employees to access. And I get it. As employers, you are very busy. You've got a lot going on. And this is where I'd say, you really have to lean on your carrier support and look at what is your carrier doing on your behalf to help you communicate to your employees. And you can go both ways, and we do this at Anthem, and I'm sure many carriers do, where we're both able to offer, for employers who would rather do self-help and they want to drive the communication strategy with their employees. There's tons of articles and videos and microsites that we offer to our employers who just want to do it on their own. They want to develop their communication strategy. They want to present the options to their employees. But then, there are employers who say, no, I do want more help and I do want more support. And so, your carriers can help you with that. And we can come in and we can help you promote that healthy messaging in the workplace. And we can meet with your employees and talk to them about all of the resources available to them. We can do that in person. We're here in New Hampshire on the ground. Or, for employees that may not live here, we can do webinars where we talk about all of these resources being made available. Because at the end of the day, if we go back to sort of the theme I started with about increasing access and reducing barriers to that access, one of the biggest barriers that we see is just employees understanding their options. And so we know that we can do a better job supporting all of you in really figuring out the best ways to communicate with your employees and making sure that they understand all of the options available to them. So with that, I'm going to turn it over to Caitlin.
Good morning. Thank you, Maria. That was a great tee up to a lot of what I'm going to share today too. So I think we'll, be in lockstep around a lot of our messaging. At United Healthcare, we would agree that behavioral health is perhaps the most pressing issue for healthcare right now in this moment. And for those of you on the line who are benefits leaders or who work in employee benefit related roles, the data here on this screen is probably no surprise to you. The need for behavioral health has been really amplified by the pandemic. People are stressed, they're anxious, they're burnt out, not only at work, but at home, right? We went through a time where parents were expected to work and educate their children and care for their toddlers, and not have, the village that normally surrounds them. Same thing for people caring for aging parents. They weren't sure whether they could see them or properly care for them. And then even for people who weren't in either of those situations, a lot of their normal social channels were taken away. And so it's no surprise that as we as a society recover from that very challenging time, people need more support around mental health than they ever have before. And that ecosystem was really already filled with need, even going into the pandemic. So, now is the time when I think we all collectively have to step up and find a way to address the 90% of people who say they need some sort of care, and the 85% of people who indicate that mental health issues are disrupting their daily life. If they're disrupting people's daily life, they're certainly disrupting their careers and their time in the workplace. And so organizations have a responsibility now more than ever to figure out how to address those challenges. If we move to the next slide, Maria alluded to the fact that I was going to talk a bit about mental health support for children and teens. This is a headline that you see, time and time again. Adults were not the only ones impacted by the pandemic. In fact, the pandemic had staggering effects on our children as well, right? Their education was disrupted, their social events, kids missing prom and graduations and major life events was not easy. And in fact, we now see that 46% of teens show signs of new or worsening mental health conditions. That's true while we live in a country where 70% of American counties don't even have a child psychiatrist. Not that they don't have an in-network child psychiatrist with any given carrier, but they actually don't have a child psychiatrist that's available to see members. 50% of lifetime cases of mental illness start by the age of 14. So we really need to make sure that we're able to get children the care that they need when those symptoms start to emerge. This is just current state, which is scary, right? The ripple effects continue for a long time. None of us have been through a post-pandemic state before. And so, we have to work together really to understand those ripple effects and then how they trickle down to the parents who care for these children. And those parents are employees of all of the workplaces that we serve. If we go to the next slide. So if you think about the children's mental health crisis that I talked about on the prior slide, how does that translate to a parent who's trying to work? At least once a month, 75% of parents miss a day of work, either full or partial, due to their child's emotional health or development needs. That's really staggering. So how do we support parents? How do we give them the resources? How do we help them navigate what is a complex healthcare system in this country to make sure they can get their children the resources that they need so that they can get back to work, right? So that their children can be taken care of while they might not be there. 58% of parents are feeling like their work quality was negatively affected by having to miss work for these reasons. And so you can understand how the ripple effect starts to occur. The child struggling, the parents missing work, that's adding stress. The parent then becomes stressed because they're falling behind on their workload. They're unprepared for a meeting. They're having to make things up. And so you can start to see how systemically this all kind of ties together. If we go to the next page, at United Healthcare, we really look at caring for adults, youth, caregivers as a full spectrum, right? So we're laser focused on guiding people to the right care across this full range of behavioral health solutions that you see on this page. That includes everything from digital support on the left side of the page to inpatient support on the right and everything that comes in between. We stratify behavioral health needs into 4 pretty broad categories: low, moderate, high, and then youth and family support. So if you think about low severity, think about the person in your population that deals with normal, everyday stress, mild anxiety. Maybe they're not on a medication. Maybe they see a therapist occasionally, but they don't necessarily have a behavioral health diagnosis. Those people need help, and we have to get people that help before they progress along the spectrum. So you want to think about, what does your carrier make available to you in terms of digital resources, in terms of telephonic resources. At United Healthcare, we have a program called Self-Help by Able To, just teaching people how to meditate, how to calm down in anxious situations. And so if we can help people who are in that low severity category at the time when they're feeling that way, we can help them not move to the next, phase in the continuum. The next would be moderate severity. And, I would guess within each of your populations, you have quite a few people who fall into this bucket as well. These are individuals who might have a formal diagnosis or have escalated to a higher level of care, such as an emergency department for a panic attack, or maybe participated in an intensive outpatient program. We want to help manage those people, and we want to work with them at every touch point. So whether it be making sure they know their resources up front, whether it be they call into our advocates about a medical concern and we have the opportunity to talk to them about the medication that they're taking for their behavioral health needs and whether they're compliant, just really making sure that people know their resources so that we can hopefully move them back to the low severity category. And then the high severity segment is people who are diagnosed with a severe mental illness. Maybe they've been inpatient, they need help managing a crisis or maintaining recovery. And it's really important that people in this bucket know their resources as well, right? We don't want people out of network at destination facilities where they could potentially be preyed upon. We want to get them to places where we know they're going to receive evidence-based care and recover and fall back down the spectrum to a lower severity level. And then we really have to wrap each of those pieces with support for youth and family, right? Support for the children who might fall into these various categories, but also support for the caregivers who need their own kind of self-help care as they're caring for their loved ones. If we go to the next slide, we talk about quality a lot on the medical side, right? We talk about quality outcomes. We talk about holding providers accountable for delivering high quality care. That is sometimes a harder thing to measure on the behavioral health side, but it's no less important. So, as we think about how we stratify our network, we really are looking to guide patients not only to care that's accessible, but care that's going to be high quality and is going to deliver results. We work closely with our providers to better integrate medical and behavioral health care to ensure members get the information they need and the access before they need it. And then to Maria's point, to work with PCPs, right? PCPs are the sort of gateway into the healthcare system, and that includes behavioral health. So really making sure that that experience in the PCP's office is seamless. We have seen strong results. So through our virtual behavioral coaching program, we've seen a 42% reduction in anxiety. When we get into substance abuse, if we can get patients to use our platinum and preferred programs, we see much lower readmission rates, much lower average costs per episode. And so it's so important, again, to focus on those quality providers and getting people to the right place for care as opposed to just in any door. As we think about quality and access, we're also focused on providers who will see patients in a time of crisis. So we have something called the Express Access Network, where we have a sort of a sub-network of providers who have agreed to see patients within 3 to 5 days. I think especially when you think about the youth and adolescent population, when you need a provider, you need them now. And so this is available not only to youth and adolescents, but adults, notating how they can get in to see someone very quickly. Moving to the next slide. We really have to go beyond those traditional network approaches. We continue to grow our network and the number of providers in our network on an in-person basis, but we also have the largest telemental health network in the country. And on all of our fully insured plans in New Hampshire, we have $0 copays for virtual behavioral health because we think it's so important to make that access available, and we never want cost to be the issue. The virtual visits have probably been, even more successful on the behavioral health side than they have on the medical side coming out of COVID. We continue to see 50 to 60% of outpatient behavioral health care continue to be delivered virtually because I think it really allows for members to adhere to their therapy plans and not have to get in the car and drive, right? If you think about a 45-minute therapy appointment that can easily turn into a 3-hour commitment if you have to drive there, get in your car, get back, all of those things. We also think it's really important to find providers that can serve a diverse set of needs. When patients think about who they want to go see as a behavioral health provider, they often want someone who looks like them. They might have gender preferences, they might have cultural preferences. They really need to be able to relate to that individual that they're speaking with. And so it becomes so important to create an ecosystem where members can sort of curate their needs through a tool that guides them to a provider that they're going to be able to be a good match with. And so, we do those things both on the in-person and the virtual side. And like I mentioned, it's also really important that we make providers available when people need them. And that's why that express access is so critical. Moving to the next slide, as Maria mentioned, we also offer an EAP, which helps remove barriers to care. I think the EAP can be a great entry into the behavioral healthcare system. That seamless approach of you start seeing an EAP provider, you use those EAP visits, and then you can quickly transition over to your medical benefits or your behavioral health benefits through your medical plan with that same provider that you're already seeing because the network is the same. And so making employees aware of this really important resource when they might need help is so important. I think EAP is one of the most underutilized resources for employers. And I think people think about it as sort of off to the side, like, oh, I'm not severe enough to have to call the EAP. But really, it can be such a gateway into your overall behavioral health benefits. And also providing relevant community and social resources, right? Think about the person who wants to see someone in person, but maybe doesn't have access to travel to that provider, right? Maybe they don't drive or they don't have a vehicle. And so the EAP and our advocates can not only, help them get an appointment for that care, but they can also find a community resource that can get them there. And so I think, it's really important to communicate this to employees before they need it. Moving to the next slide. I think it's also, it's sometimes a second thought of how do you support your management team in this world of, we want to be really accepting of behavioral health care. How do we help our management teams have the resources that they need to be able to support their employees, right? Because that's a caregiving role in itself. And so through our EAP, I think one of the again underutilized things is the ability for your management team to speak with someone about their needs in managing people. We offer unlimited phone consultations with licensed consultants who can help a manager figure out how can I help my employee with their anxiety, their emotional needs, their depression. How can I work with them within the confines of the workplace to support them in a way that's really appropriate and helpful. So I think it's important not to forget that the EAP certainly provides a great resource for employees, but it also is a great resource for employers. And then moving to the last slide to wrap up, I think it's incumbent upon all of us to think of the future of better behavioral health care for everyone as a society. It needs to be culturally relevant, meet people where they are. It needs to start to be measurable. We need to have quality outcomes and make sure that, we're getting patients. We have a real responsibility to get patients to a provider that's going to help them and give them measurable results. It needs to be equitable. We need to be thinking about social determinants of health and making sure that everyone within a population, regardless of their socioeconomic status, is able to get the care that they need. Make it personalized so that they, really get what they need out of the session. And it's not a one size fits all approach. And therapy and behavioral health care is really so unique to each individual. And certainly, access becomes an ongoing problem for all of us. And I think that one really great thing that came out of the pandemic is that virtual care seems to be here to stay. And so we can all continue to educate employees around how that can be a really useful benefit. So Ernesto, I think you may have some questions for Maria and I.
I do. And thank you. That was a wonderful Caitlin, and wonderful Maria. So if Maria rejoins us, there we all are. To change my view here so I can see everyone. And I also want to remind to remind our audience that there's a Q&A function that is open now. And so if you have questions for Caitlin or Maria, please do write in. I will be happy to get us started though, because there are lots of points in both of your presentations that I think are really important, and I would love to expand on a little bit. Wanted to start with all these questions are for both of you. So, but I'll reference where I first heard, got thinking about it. Maria, you were describing rising healthcare costs related to mental health issues amongst employers, and I'm wondering, just like with physical preventative medicine, are those costs eased the earlier that you treat? And would you say that there is a preventative aspect to mental health care? I think you alluded to it, but maybe expand on that a little bit.
Sure. No, it's a great question. And I think it drives home, the focus of treating mental health as primary care, because we absolutely believe this is preventative care. If you think about, how well understood it is that if you diagnose and treat cancer at a very early stage, you have a much better chance of survival and living a normal life. But folks haven't always thought about mental health in that same realm. And that's the point about treating it as primary care. We need to think about it as primary care and as preventative, because the earlier we can diagnose these issues, the better chance we have to treat. Caitlin talked a lot about the issues in youth and teen. You think about if those go untreated, those mental health conditions, how do our youth and teens survive in society? How did they grow up? How do they live a normal life? They don't. And so we have to get, our youths, our teens into the right level of mental health care to treat their conditions. But when you think about adults and the employees that you all employ, if you can get them to leverage the resources and you can have their mental health conditions treated, number one, the culture in the workplace will improve because each of your employees' lives have improved. And we all know that impacts the culture in our environments every single day. And I think we need, employees who, can be productive, who can be present, each day to do the job that you hire them to do. And so if you're attacking these things early on, you have a better chance at achieving those results. So, really focusing in. And I think that's where the work that we're doing with the primary care practitioners. So when you even think outside of the realm of a traditional therapist or psychiatrist, our primary care offices, we are incenting them to actually place mental health specialists right in the primary care practice, so that as you go in for your annual preventative care exam, not only are they just asking you a list of questions on the page, but there's a resource right within their office that, depending upon your responses in your discussion, there is a specialist right within that office who generally maybe won't be your therapist or the person that you might see, but that mental health specialist can meet with you to the side before you leave that appointment and get you set up and or referred into another level of care that you might need.
Caitlin, any thoughts on that?
Yeah, I mean, I think Maria's right. The two are so intertwined, right? Medical care and behavioral health. And I think even beyond primary care, if you think about people who are facing a difficult diagnosis, right? Someone who's been diagnosed with cancer or MS or something else that, that's quite a traumatic diagnosis. I think it's so important to pair behavioral health care needs specifically with that diagnosis as well. And that's something that we think a lot about, and that as we work with our advocates and our clinical programs, making sure that behavioral health is embedded in each of those medical programs as well, so that even if a patient didn't have a behavioral health diagnosis going into that, they may very well now, and they may need a different level of support than they needed before their diagnosis. And so I think the access to that care becomes really important as well.
Is there an aspect of the early care or the preventative care that employees or employers might find within EAP programs that's akin to on the physical health side? I might take up running so that I don't have heart disease later, but I'm not trying to cure heart disease before I have it, but there are behaviors, I guess, that are preventative overall before you even have an issue. And I'm wondering, like, if those types of things are within the EAP, is that part of the messaging that employers have to get out? Is this isn't just for when you feel bad. This is like, do this before you feel bad to prevent feeling bad.
Oh, definitely. I think stress and anxiety are so bad for all of us, right? They lead to so many poor clinical outcomes on the medical side that absolutely, if we could get more people to use the EAP, use those 3 or 5 free sessions, whatever's in your benefit plan, and just get connected with someone who can help you learn those coping skills before you need them. I also think that's where the digital avenues come in as well. Certainly not every employee, not every generation wants to pick up the phone and speak with someone or have a video call with someone, but they might be willing to do a guided meditation. They might be willing, to think about how they manage anxiety in that way. And so I think giving a variety of those kinds of tools, but I think you're spot on, Ernesto, that everyone can benefit, even from a medical perspective, in learning how to manage stress and anxiety.
Yeah, and I would agree. Your EAP programs are certainly something you should look at, but to the extent that potentially they don't offer the type of support you need, and it's really just about well-being in general, I think that's where many employers are offering these emotional well-being resources that I talked about. And again, as Caitlin said, many of them are leverageable through the digital channel, right? So it allows employees to access it on their own time when they're comfortable in the manner that they're comfortable with. And, whether that's, just doing a self-assessment, like, where am I, right? Like, I had a bad day. Like, where am I on the mind, from a mindset perspective? And what can I do to make myself feel better? Things like doing a self-assessment are easy tools that are made available that you can do. And then just by doing that, you're going to get offered solutions, whether it's, come up with a workout plan because, the workout is going, I always joke. I mean, my therapist is my spin instructor. She kicks my butt, a few days a week, and she tells me to just keep going and keep going, and when I feel down, I'm like, all right, I hate spin, but I'm going to get back on the bike because I need to see her, and I need her to yell at me through the screen and tell me that life is good. And, so each one of us finds, value and deals with stress and anxiety differently. And I think that's why and Caitlin used the same words, I think it's so important, meeting every individual where they're at. We like to say hyper personalization. The way that, I deal with stress and anxiety is not going to be the way that you deal with it, Ernesto, or the way you deal with it, Caitlin. So we have to make multiple opportunities and solutions available so that folks feel like, I'm getting what I need, not what, my boss told me I need. This is truly personal to me.
And it's something that I think we can replicate for children and adolescents, right? I mean, I know even with my 5-year-old, we'll practice belly breaths before bed because, teaching her at that young age, how do you bring yourself down from, a stimulating day into a time of relaxation? We need to give employees those tools to use with their children as well, because I think, that's when it starts, right? That's when we learn those coping mechanisms.
Yeah, that brings me to a question I had jotted down. Related to that and related to youth mental health, and that was, do you see, even for parents who are employees who may not be feeling that they have a specific mental health challenge they're going to turn to that EAP for, is them just using that tool to learn more about their own mental health useful in identifying issues their kids may be having earlier?
So I feel very strongly about this one, and the necessity about when you're treating mental health conditions for your children, that you yourself need the same or similar support. And I think that, Caitlin talked about this need to, sort of understand the quality of care we're getting in the mental health space, right? So much we talk about is just the necessity to see someone, but is the person you're seeing or their care you're receiving actually driving results for you and your family? And I think when you think about, issues with your children, for everyone, I have 3 kids that are growing up and a couple of teenagers, and it's super stressful what they deal with every day, things that I never had to deal with. And I think about myself needing tools for when they have anxiety or they have issues. How do I, as the parent, react? And how do I address those concerns with them? And I think that's where we're looking. I mentioned In Stride. It probably sounds like I'm doing a commercial for them, but I spent a lot of time with this provider that we've just brought into the state. They started and developed this program in Massachusetts at the McLean Hospital, and we've been able to bring it to New Hampshire through virtual, which is amazing. And the program is designed to work with only children ages 7 to 22. But the differentiator with the program is the wrapping of services around the family. So if you think about, the child may be needing to work, with a therapist or for their anxiety or depression, when you go into an In Stride program, the family also gets services. So the therapists are meeting with the parents, meeting with the siblings, talking about, the strategies that the family needs to cope with the issues that one of their children might be facing. And I think, what I'm so passionate about with this program is the recognition that when one person in a home has a mental health condition, it impacts everybody, or can impact everybody. And I think for those of us with growing children, we're not necessarily equipped to know how to deal with it. And so making sure that whether you're in an In Stride where the services just come along with it, or to your point, Ernesto, you're taking advantage as the parent to other programs available to you while you've gotten your child the support that they need, is extremely important. And I think, I think more and more we're recognizing it, but we have to reduce the stigma for the parents to understand that you going into therapy to help you address the issues with your child is not a bad thing, right? It's going to arm you with what you need for how to address the situations that are arising in your home every day. And importantly, how are you managing with your children in the home that maybe don't have the mental health condition, and making sure that you're balancing the needs of both. So I think it's hugely important.
Caitlin, did you want to add on to that?
Yeah, I mean, I completely agree. We do similar things through our family support program. So, it's about getting the child or the adolescent the care that they need, whether that be applied behavioral analysis in certain situations, child or family behavioral health coaching, digital tools and engagement. But then it's wrapping all of that with the caregiver support, as Maria alluded to. I mean, it's so critical that the caregiver feels supported. And I think, you often hear as a parent, kids don't come with instruction manuals, right? And they certainly don't come with instruction manuals when you're in crisis. So I think making sure that parents know about those levels of support before they're in crisis mode. And Ernesto, to your point, the more you can get people engaged in the ecosystem before they need it, the better, right? It's not enough to just mention at open enrollment that you have access to these resources and then not talk about them again until it's benefit selection time again. It's, getting out throughout the course of the year and reminding people about the EAP, about their advocacy resources and how to use them, so that they're already familiar and know what to tap into when they're in that crisis mode. Because I think we've all been there, right? Where you need a service, whether it be medical, behavioral, whatever it is, and you're like, oh, where do I turn to now? We don't want people asking their neighbor or their friend. We want them, consulting us, who has the data and the resources to be able to help them.
Yeah, that makes sense. And it is, you mentioned the destigmatization of mental health, of seeking treatment for oneself, but I have to imagine that there's also a challenge for parents in acknowledging that their kids have a mental health problem, because it may feel like an indictment of their own parenting if they're not well educated on the topic.
Yeah, and how many parents maybe miss that opportunity to get help early because of that stigma?
Right.
Well, yeah, and I think it's, if you think about, and again, this is why the ecosystem is so big, because you think about our school systems, and you think that that's where these problems generally may start to develop or come through. And how are parents, what information are they getting from the school system about their children? What do they ask, the questions that they're asking? And I think, I think our school systems are doing the best they can, but with very limited and short supply of the right level of folks to help support our kids. I think they're doing a phenomenal job, I would say, on a very tight budget, and again, limited access. And so, making sure, and I think that's the importance of these programs that we're going out and looking for to bring into the state. It's programs that they already know all this. They know that when they're, working with a child, they have to meet with the folks at the school, right? The counselors that are dealing with the child every day. They have to meet with the family. They have to meet with the siblings. That's what's important about, I would say, that next level of mental health provider that we're trying to make accessible to our members. Because, obviously some people just might need the therapy, the one-on-one, and that works for them. But for many, that will not be enough. And I think especially for children and youth, the fact is we're sending them off to a school every single day where all those stressors, those potential stressors, and the things that drive the anxiety exist. So the folks that are dealing with our children and youth need to understand that, and that needs to be factored into the care plans that they're developing.
I have we have a comment, an observation that I think might be worth commenting on from one of our friends in the audience. He says, it's great to help teams deal with mental health. However, we also know that culture eats strategy for lunch. So if we don't change the company culture to be more accepting of mental health issues, it's difficult to sustain. For example, most organizational metric management systems use extrinsic motivation, i.e. carrot and stick, that often work against what we're talking about in this webinar. And I think, piggybacking off that observation, are you seeing companies that are doing it right? And what are some of the things that they're doing culturally to make this work?
Yeah, absolutely.
I do. You go, Kate. Sorry.
So, I mean, I think first and foremost, at a very basic level, like communicating out what people's resources are, right? So that they're familiar with them when they're in that time of crisis or they start to need the benefits, they know what they are. Then I think it comes down to the managers, right? People work for managers, they don't work for companies. So helping managers be able to support people through a difficult time, whether it be saying, your team seems stressed, why don't you implement walking meetings? Why don't you encourage people to get out of the office for 20 minutes at lunch, whatever it may be that's appropriate within the organization, but really making sure that your management team feels empowered to work with individuals to give them those resources. And then, I think we've even seen some extreme examples. We have a client that went so far as to highlight people's behavioral health journeys, people coming forward on an identified basis and saying, I struggle with anxiety and I see a therapist, and almost making a communication campaign around it. And obviously that's very bold and not everyone's quite comfortable, but really that's the epitome of removing the stigma, right? Is having people raise their hand and be willing to share their actual diagnosis and their journey, just like they would with a medical diagnosis, right? People talk about being a cancer survivor. They talk about, difficult challenges in their medical health. But we don't often see people being as transparent about it on the behavioral health side. So I think clients who have gone, to the far right side of the spectrum have really created a culture where employees feel willing to stand up and say, I needed help and I got help and this is how it worked.
I can imagine
Yeah,
how
I mean,
powerful that would be.
yeah. And I agree. I think, everything Caitlin said is really important. And I think it's something else that she said earlier, which is, just talking about this once a year in open enrollment is not enough. And, you have to not only do it at open enrollment, but culture, I agree, culture will eat strategy for lunch. I say that all the time myself as a leader. And it's about setting a precedent as a leader. And that's the leader at the top. And as Caitlin said, all of your managers underneath you who are people leaders, and reinforcing the importance of this with them and giving them that latitude to, meet their employees where they're at individually. I really fundamentally believe in the one-on-one meetings. I do those with my team very often, so that I understand their individual needs. And then as a leader working with my direct team, I can respond to those. And I can see, do I need to have a conversation with them about, all the support that's available out to them, or are they bringing me issues that they're seeing if they also are people leaders? And then how do we together work to make sure that it's not a one and done at the beginning of the year, but that we're reinforcing the message throughout the year?
Do you see any either of you see any employers incentivizing the use of the EAP? Like almost, can you earn points for getting in and using your EAP? Do some employers say, I'm specifically carving out, an hour a week that I'd like you to go in and do this instead of the other parts of your job or something like that?
I think to some extent, I think, it gets tricky, like how do you track that? How do you measure that? But yes, to some extent, I think we do see employers starting to, through their wellness programs, incent things that are good for people's, mental well-being. And so I think maybe not that direct link to the EAP, but I think certainly things that are good for people's mental health, like walking or sleeping, one of our wellness programs, pays people to walk every day, to get the right amount of sleep every day, to complete the health survey, which certainly, includes behavioral health related questions, to get their preventive care, which again, as behavioral health is tied to preventive care, so I think indirectly, but maybe not, I haven't seen anyone do it quite so overtly as, you work with the EAP and you get an incentive.
Yeah, I think it's more general, as Caitlin said. And I think the most basic of health plans generally offer allowances, so funding for employees to take advantage of their well-being resources. Whether that's the most basic of, well, for me, I want to go to the gym every month. So if you think about that, going back for a long time, most carriers have offered gym reimbursement, right? People didn't used to think about that as well-being, but that's exactly what it is, right? And so, or through EAP, giving an allowance to go see a financial advisor. A lot of EAP programs offer that, so that if it's the financial issues that are bringing you down, go get the support that you need to meet with an expert. So, I think it's more around, here's an allowance, and you can choose as the employee to use it, within the confines of the programs.
Perfect. Well, that is a great note for us to end on as we are at the top of the hour. I want to thank our audience for tuning in today. This was a great conversation and went by so quickly. You had so much interesting data to share. I did not get to half my questions, so that speaks to the compellingness of your presentation and the passion that you both have for this topic, which is really great. So we appreciate you. We thank you. Thank you to United Healthcare and to Anthem for sponsoring today's webinar. Thank you, Maria. Thank you, Caitlin. I hope that you have a peaceful rest of the day.
Thank you.
Thank you, Ernesto.